Here are 5 symptoms we have to manage at the end of life. These next 5 symptoms are the symptoms that I mostly see at the end of life on hospice. This doesn't mean that everyone's going to have them or everyone's going to experience every one, but I like to cover this in a general way and give you the 5 top symptoms I see at the end of life. Number 1, and I bet you can guess this one, is pain. Dying is not painful. It's the disease that you're dying from that can be. And some diseases cause more pain than others, so it just depends. And I've definitely seen people on hospice dying who have never had any pain. And then I see others that have a lot of pain, and we need to do a lot of different things to manage that pain. Pain is the first one. How do we manage it? We either do oral medications, meaning pills or tablets that you swallow, sublingual medications, which means medication that's given buccally and absorbed in the gums, transdermal, which are patches for pain medication. There's something called a CAD pump, which is given through a sub-Q needle, which is a tiny little needle stuck into the adipose tissue that can provide pain medicine. There's a Macy Catheter that is a rectal device, so you can give rectal medication, and then suppositories. People always become afraid with the idea of suppositories or rectal medications, but really our rectums are supravascular, and I've seen it work really well with managing pain. Before we go on with this video, I want to talk to you today about the channel's sponsor, the Macy Catheter. The Macy Catheter is a delivery device for medications. Giving medications to a patient or a loved one or yourself can be a struggle, but it doesn't have to be. The Macy Catheter is a dignified way to help your loved ones, and once it's placed, it stays in and the patient or loved one doesn't even feel it. The Macy Catheter is placed rectally, and before you naysay, rectal administration of medications is proven to be effective, efficient, and a dignified way to give medications. And something I love about the Macy Catheter is that the patient can actually give themselves medication. The loved ones can give the medications because we all know that hospice nurses are not always around. And the patient can even be up and walking around with the Macy Catheter inserted. So in this graphic, you can actually see how the Macy Catheter actually rests on the person's thigh once it's inserted. For more information on the Macy Catheter, make sure to check out the link in my description, and please enjoy the rest of the video. Number 2 is shortness of breath. Again, not everyone will experience shortness of breath at the end of life, but some people will, depending on the diagnosis. Something like COPD, which is a lung disorder, people will be experiencing shortness of breath long before they come on hospice and are usually even on oxygen prior to being on hospice. There are other diseases that can cause shortness of breath, like lung cancer, or sometimes someone is having like air hunger, which is not necessarily shortness of breath. It's just the feeling of not being able to breathe very well. We can also manage that. So how do we manage shortness of breath? There are several ways, and we don't have to use all of them, or we could use all of them. It just depends. 1 is oxygen. 2, a nebulizer machine. So you put medication in it like albuterol or Atrovent or sometimes even normal saline, and they use the nebulizer to help with the shortness of breath. And then of course, medications like morphine, liquid morphine, one of my favorite ways to manage shortness of breath. Just a little bit of a liquid morphine in the mouth that absorbs through the gums. It relaxes your central nervous system, relaxes your diaphragm, and helps you feel like you can breathe. There's one more medication that I forgot to mention for pain and shortness of breath, and that can be steroids. Steroids helps with inflammation, so a lot of times you can be on low dose steroids or high dose steroids, and that can help decrease the inflammation in your body, which will help take away that pain and possibly shortness of breath. The third most common symptom is agitation, restlessness, or confusion. I'm going to lump those all together because I commonly see them all together. So what are some non-pharmaceutical things we can do to decrease stimuli that will help decrease confusion, agitation, restlessness? A lot of times it's just turning down the lights, playing soft music, not having loud conversations. A lot of times just kind of calming the room down will help decrease that agitation or restlessness. When that doesn't work, of course, we have medications we can give. Sometimes we'll give something called Haldol, which is a liquid medication, again, absorbed sublingually in the gums. There's all types of medication. Ativan we can give for agitation. It just depends on the person, their age, their diagnosis, many things we can do and give to help with agitation. The fourth symptom I see is nausea and vomiting. This really only happens with specific diagnoses, so I don't see it all the time, but certain diagnoses that involve like like your stomach, your intestines. It really depends. Sometimes medications are making you sick, and sometimes your disease is making you feel nauseous or vomiting frequently. So there are many things we can do to help with that. I love using suppositories or something like the Macy Catheter to administer medications when you're feeling nauseous or vomiting, because when you're feeling nauseous and vomiting, it's really hard to take medications, take pills. Rectal medications, and in this circumstance, work really great. Also, with nausea and vomiting, you can try changing your diet. That can help. However, when someone's on hospice, I hate giving them a diet restriction, but that is something that possibly could help with the nausea and vomiting. And then as a very, very, very last resort, we don't really want to do this, but if we have to, we can place an NG tube, which is a tube that goes up your nose and down into your stomach, and then it's placed on a suction machine, and it kind of decompresses your stomach to take away that feeling of nausea and vomiting. Again, not ideal, because this going into your nose, into your stomach is not comfortable, and then it resting there is not very comfortable. However, sometimes you have to outweigh risks versus benefit. If it makes that nausea and vomiting go away, many people will live with that NG tube in instead of feeling nauseous and vomiting all the time. So it just depends. Again, those are extreme measures, but we can do it. And last but not least, number 5 is seizures. Seizures don't normally happen, but we do see them specifically in certain diseases like glioblastoma. So with those, we try to keep people on medications so they don't have it. Like before they have seizures, we'll put them on medications so they don't have the seizure. Every once in a while, they still will, even if they're on a medication like Keppra. So we usually keep suppositories in the house to help manage the seizures. The suppositories are a compound, which has like 4 different medications in the suppository to help relax the patient if they're having a seizure. And always call your hospice company if your loved one who's on hospice is having a seizure. Call us so we can make sure we make a visit. And just remember that you don't really have to do much except for keep them safe. Just a couple quick things what I mean by keep them safe. If they're lying in bed and already safe, let them be. Don't do anything. But if they're sitting up in a kitchen chair and they're having a seizure, just keep them safe in that chair, or if need be, lay them down so they're safe. You don't want them falling and hitting their head and causing more issues. So again, these are the 5 main symptoms that I see us managing the most. However, all of them are likely not going to be happening. It just depends on the patient's disease, their age, their personality, all depends. Like I said, some people have none of these symptoms, some have 1 or 2, but we're usually always able to manage them.